Okay, so this is week 4 for wellness, health disparity and health literacy. The health disparity, we're going to watch a documentary, a good documentary talking about what health disparity is, and health literacy. We'll start with health literacy. Here's our lecture questions. Health literacy is a core kind of thing. It's kind of making sure your clients understand what you're saying. So putting it into language that's accessible, that they can understand. It's the degree to which individuals have the capacity to obtain, process, and understand basic health information needed to make appropriate health decisions. You know, like the further you get into this program, that OT has its own little world of language and terms and thinking and how we do things, and becomes second nature to us, especially after you've done this for a while. But it isn't like that for our patients. It's all new. It's confusing. What are you saying? What does this term mean? They don't want to act dumb, like they don't get it. So it's really up to you to put it into the accessible, simple language that they can get, understand, and grasp. And that's really hard to do as a student and as an OT early practitioner, because you're just learning all the stuff yourself. So it's all new to you as well. But it's a skill you really need to kind of foster and develop. Skilled OTs are really good at this. It becomes second nature after a while to really not talk in complicated medical kind of language. Who is at risk for health literacy kind of issues? It's greater among older adults, those who are poor, limited education, minority populations, different cultural immigration kinds of mix, persons with limited English proficiency, LEP. This is a huge deal with this. And they're the ones that kind of are left behind in a lot of cases with a lot of the basic health concepts that can make a big difference in their health, in their lives, because of the issues around health literacy. Different levels of health literacy: basic, just the ability to understand the health information that is provided to you, and the understanding these exercises, these recommendations that you're giving, to the patient, to the family. Communicative, the ability to find information, understand it, use different sources of communication, and apply new information to changing circumstances. Critical, the ability to make informed health decisions in the context of everyday life, at home, in the community, at the workplace, in the healthcare system. Skills for health literacy, what becomes the things that people might have issues with? Obviously reading, writing, listening, speaking, normals, critical analysis. This is a skill, again, it becomes secondary if you've been in healthcare for a while, but it's a skill that a lot of people don't have. I'll talk more about that in a second, what that means. But really kind of take an objective look at what you're getting for information. This is something I'm not conscious of, but like when my parents were running into health issues, I come from a large family, and my siblings would try to interpret what was going on, and I could quickly see that they were missing the bigger picture. It's just a skill that a lot of people just don't have, because healthcare can be so complicated. Communication, interaction skills. What do we do around this? This is a big part of anybody in healthcare. You need to kind of be really good at this. All health-related information and education should match that person's literacy abilities. Really got to figure out how much of this they're grasping, how much they're not. It's got to be culturally sensitive. This can be a big deal, even in Maine, or we're kind of isolated up here, but a lot of Native American populations, immigrant populations, and Somalis in Lewiston and other groups coming in. This is not so much culture, but people going from urban to rural areas within Maine. There's sometimes kind of different worldviews that see things so differently. Matches the recipient's verbal, cognitive, and social skills. Healthcare providers have a duty to provide information in simple, clear, and plain language to check that the patients have understood. This is the thing. We have to really make sure that they're getting it, the information, before ending the conversation. Your job is not just to tell them, it's to make sure that they showed you, that they understood what you told them. And I think, again, this is an underrated thing that OTs do a lot of, because a lot of times you'll find patients, when they go to the doctor, they come out of there kind of confused. They're not sure what the doctor said or what's going on. a lot of cases it's up to us, kind of the non-doctor healthcare professionals, to kind of interpret what's going on, what the doctor said. Can't tell you how many times I've done that. Patients may have negative feelings and emotions related to their ability to read. They can't read, they don't want to, or understand, they don't want to acknowledge that, feel stupid kind of thing. And it's a very intimidating environment, healthcare. Again, you're in for a while, you kind of forget how intimidating it is, but it's very intimidating with our world and our white coats and our titles and all that. Scary kind of environment. And it's hard for patients. It's hard to tell patients when they don't understand. They can hide it well. People who struggle with health literacy, struggle with understanding what's going on with the doctor saying, they experience more preventable hospital visits and admissions. They're just not doing the basic kinds of things they need to do. They are significantly more likely to report their health as poor. They're likely to skip all these really crucial preventative things that keep you out of the hospital, like mammograms, pap smear, flu shots, colonoscopies, those kinds of things that are huge. But if you don't really get the bigger picture, you don't see why it's so important. Challenge, this is kind of a challenge for teaching too. Anytime you're kind of talking verbally, people just don't get a lot of it. You understand about half of what clinicians explain to them. So, again, the idea is to keep it simple, not to give too much information. Great example is the home exercise program. They have like a folder full of exercises and recommendations from the hospital, none of which they were following. Overwhelming. Just give them one exercise, one thing. Can they do that? And then we kind of build on that. Plain language is a strategy for making oral information easier. Elements of plain language. What do you mean by that? Get away from all that technical medical stuff. Simple, simple, simple. Trying to explain it to your grandmother, so to speak. Breaking down complex information into understandable pieces. Again, not all this slew of overwhelming stuff. One little piece at a time. Organizing information so the most important points come first. With older folks, stereotyping, but I would really simplify, and repeat. So there's like this one thing that I wanted them to do. Say, when you're standing up, I want you to come to the edge of the chair and push up with your arms. That's simple, or nose over toes. And I would say this over and over again to everybody, so they would start to get this. Or always use the gait belt, or whatever it was, something simple. Speak clearly and listen carefully. Listening is where a lot of healthcare people struggle. A lot of healthcare people are into educating and telling what they need to do, but they kind of struggle with this slowing down and stop talking and just listen to the person. You kind of see where they're coming from. Those who are not speaking English well, plain English will not help. Ensure that all language accessible services, including translation, plain language. You may need a translator. Just thinking about translating, not for language, but for sign language. I was seeing a client once in an outpatient setting, and I had to have an interpreter, a sign language. One was there to kind of make sure that she understood what I was telling her. Ask open-ended questions. Elicit cultural beliefs and attitudes. Tell me about the problem and what may have caused it. Why are you here today? How can I help you? Those sorts of things versus quick yes/no things like, did you understand what I said? And they, of course, nod their head. They understood very little of what you just said. Checking for understanding. The teach-back method. We'll get more about that. It's a huge OT thing, teach-back. We'll talk more about that in a minute. Facilitate healthy decision-making. Use short documents to present bottom-line information, step-by-step instructions, visual cues. People process and use a limited amount of information when making decisions. They can't really take in a lot. What are the two key things I need to know when I have to make this decision? Align health information and recommendations with access to services, resources, and support. Here's a good example. Hand washing. It's huge. Amazing, simple thing you can do to prevent sickness. This is, I don't know, maybe a little bit wordy, but it kind of gets thing you need to do. Things you can do to stay clean and healthy, times to wash your hands, before, after, pretty simple. The pictures, the visual cues, that sort of thing. What is teach back? Patients should repeat in their own words or demonstrate. This is the big thing that OTs do, is demonstrate what they need to know or do. Every time I teach somebody how to use adaptive device, I would ask them to demonstrate to me. I would ask them to do it. I would just show them, give it to them, and leave. Can they repeat back in their own words what I just told them? Teach back is a measure of how well you explained the concept. Provides a chance to check for understanding and the need to reteach the information. Teach back is kind of rephrasing if a patient does not get it. Ask the patient to teach back the information again using their own words so you're comfortable that they really understand it. If they still don't understand it, consider other strategies. Sometimes I kind of go through a third party, like the daughter was there. It's like, could you explain this to her? I don't think she's getting it, or whatever. Teach back, additional points. Do not ask yes/no questions. Do you understand? Do you have any questions? Because they're always going to say no. I do understand, and I don't have any questions. Chunk and check. Teach the 2-3 main points for the first concept, and check understanding, reaching teach back, then go on to the next concept. Build slowly, and keep going back and repeating. Teach back elements of competence. Responsibilities on the provider. Use caring tone of voice and attitude. Use plain language. Ask patient to explain using their own words. Useful and important patient education specific to the condition. Document use of and response to teach back. Asking for teach back examples. Ask patient to demonstrate the taught task or verbalize understanding using their own words. I want to be sure, here's an example. I want to be sure I explained everything clearly. Can you please explain it back to me so that I can be sure that I did? What will you tell your husband about the changes we made to your blood pressure machines today? That's a good one. It's not condescending or, do you understand? Can you tell me that kind of thing? It's a good way of kind of getting at the teach back kind of thing. Teach back is supported by research. Asking the patients to recall and restate what they have been told is one of the 11 top patient safety practices based on the strength of scientific evidence. In the absence of teach back, the only indicator of misunderstanding may be a medication mistake or patient error, which can be fatal, really. Okay, so that's kind of the whole health literacy thing in a nutshell. I know those slides well. There'll probably be some questions on the midterm on that. Health disparity. What is health disparity? The differences in health amongst individuals. Why does somebody have such good health and ultimately a long life versus somebody else, poor health, not living as long? There's certain determinants that make the difference as to why somebody is healthy and living longer than somebody else. They really cleanly figured this out scientifically. It's linked with social, economic, and environmental disadvantages. If you're an economic disadvantage, you're not going to live long as somebody who is more of an economic advantage. This isn't the millionaires compared to the rest of us. This is, as you'll see in the documentary, somebody that makes $80,000 a year compared to somebody that makes $50,000 a year. There's a difference. How much money you make in terms of how long you live and how healthy you are. Social disadvantages, you talk about living in certain areas. This kind of blurs into environmental disadvantages. You live in a poor area, poor access to not only health care, but health-related activities, maybe a lot of violence, fear, poor access to good grocery stores, all those sorts of things. Health disparities adversely affect groups of people who have systematically experienced greater obstacles to health. If you lived your whole life in a poor, isolated area with a lot of violence and unemployment, not much opportunity, it's going to impact your health. Characteristics historically are linked to discrimination or exclusion on race, and other factors. What is health equity? The attainment of the highest level of health for all people. This requires the elimination of health and healthcare disparities. These disparities drive the health inequity. If it wasn't for the disparities, we're all kind of living in the same situation with the same environment, opportunities. You probably have more of a flat curve in terms of health equity. Health and wealth correlate. It's like I was saying, the more money you make, the longer you live, the healthier you are. Wealth inequality equals health inequality. Determinants of health. These are kind of the factors that determine your health. It's a complex relationship between all of this. Definitely genetics, definitely biology, but there's behavior, socioeconomic status. There's a huge role. The physical environment, where you grow up, where you live. Racism, for sure, plays a role in different kinds of subtle kind of ways. Legislative policies of a particular area or state. Discrimination, conscious and unconscious discrimination. And then the health literacy levels, we already saw that. Good indicator if you have low education or your English as a second language. Poor health literacy, it's going to affect your health. Social determinants of health, we talked about that. These are the social determinants of health. These are kind of breaking down into social and physical. The social ones are on race, ethnicity, gender, differences in health around gender, sexual identity, orientation, disability status, or special healthcare needs. Physical determinants of health. Availability of and access to high-quality education, nutritious food, decent and safe housing, affordable, reliable public transportation, health insurance, clean water. We just take it for granted. A lot of us that we're going to have great, clean, and non-polluted water. Some cases they don't have that, or there's horrific septic systems or lack of septic systems. So it's just the things that we take for granted. Some people just don't have that, and they kind of grew up in that, and it's definitely impacted their health and the length of their lives, really. AOTA. What does AOTA say about health disparity? OT practitioners have the responsibility to intervene within disciplines to limit the effects of inequities. Practitioners have knowledge and skills in evaluating, intervening with persons and groups who face physical, social, emotional, or cultural challenges to participation. You need to be conscious of that. Health literacy is a great example of that. And kind of help the person work through that the best we can. Consistent with the core values and attitudes of OT practice. Okay, next. If you're unable to access that documentary, definitely want to contact me so you can get it too, so you can watch it.